who officials say is the first person to contact the virus inside the U.S., said today that she's doing well. Officials at Texas Health Presbyterian Hospital released a statement on behalf of Nina Pham, thanking everyone for their kind wishes and prayers. Officials believe Pham contracted Ebola through a breach of protocol at the hospital, where she helped care for Liberian Thomas Eric Duncan, who died from the disease.
In 12 on Health, a local pulmonologist addresses new questions about how Ebola may spread.
And the need for high-level precautions when near a potential Ebola patient.
Okay, here's 12 on Health reporter Gillian Neff.
And guys, as CDC investigators work to understand exactly how the Dallas nurse contracted Ebola from her patient, local doctors who deal with infections and emergencies say they expect the CDC to recommend stricter precautions in the coming days in case the virus can spread through respiratory droplets.
We can sneeze it out, it could be in the air, and we could actually inhale that, and that's the mode of exposure that we're concerned about with Ebola right now.
Do you think that might be the case?
I absolutely think it might be the case.
Stratford pulmonologist Dr. J.D. Sidana says the Dallas nurse's case of Ebola presents some mystery as to how the disease spreads. As of today, the CDC does not necessarily recommend airborne precautions like these carefully fitted masks when dealing with possible Ebola patients. But the chiefs of infectious diseases at local hospitals, including Dr. Zane Saul of Bridgeport Hospital, say they're not leaving anything to chance. Airborne precautions are already part of their protocol. Dr. Sidana agrees that this is no time to skimp on prevention.
We would rather take more precautions now and know that we overdid it rather than do less now and say, geez, we missed an opportunity to limit and control this epidemic.
A rumor was going around that at least one local hospital has a case of Ebola right now, but hospital officials quickly dispelled that, saying they don't even have a suspected case. Dr. Sidana says this is the kind of contagious illness that has people making false reports and jumping to conclusions, so he says we might be hearing lots of rumors. For facts, we have a link to the CDC website for you. Just go to news12.com, and they are updating the CDC website regularly.
But you can see how there can be a breach when things are happening so quickly in an emergency room.
Sure. They have the equipment. The question is it
using it
properly fitting?
Yeah. Gillian, thank you.